Forced sterilization of Indigenous women. Sterilization is any number of medical methods of birth control that intentionally leaves a person unable to reproduce. Forced or coerced sterilization was a government-mandated program to sterilize a specific group of people. Occurs when a person is sterilized after expressly refusing the procedure or without their knowledge or not given any kind of opportunity to provide consent. This can be seen as recent as 2018 in Saskatchewan, Northwest Territories, Yukon, Manitoba, Ontario, Alberta, BC, and Quebec. Indigenous women usually didn't have access to healthcare services, resulting in one of the highest rates of maternal and infant mortality. Forced sterilization was initially intended for people with intellectual disabilities, seen in Alberta from 1928 to 1972. By the end of the 60s, Indigenous women became the main target of sterilization due to women having more access to healthcare. In 1969, birth control, including sterilization, was illegal in Canada. There wasn't allowed any kind of talk about birth control or abortion. Alberta and BC are the only two provinces that enacted legislation allowing the sterilization in the 1930s. 1939 to 1941, the Northwest Territories tried to legalize forced sterilization, but the attempts failed. This initiated them sending the women to hospitals in Alberta and BC. In 1970s, both the US and Canada stopped promoting pro-sterilization policies, but they didn't outlaw them. Why is this information important? Well, going into healthcare professions, consent is one of the most important things. You are not allowed to do any kind of procedures without it. It can be something as simple as consent to an assessment that involves any kind of touch. This problem clearly goes against that. As a nurse, you are with these patients every single day and you're getting to build a therapeutic relationship with them. You are there to advocate for your patients when they are not able to. This issue can give a nurse some education on why an Indigenous woman might be hesitant on coming in to get care. There is an understanding of why they may be standoffish. Knowing about this situation can help the nurse create a more positive and safe space for an Indigenous woman, let alone any patient, because you're not necessarily going to know they are Indigenous. My take from this information. All the research I have done, I feel like there is a gray area. I did a lot of reading and I found very contradicting dates, and the timeline seemed a little fuzzy. I would get very different years and dates, so I went with the ones that I saw the most of. I wish this was more talked about and more publicized. I didn't know anything like this would or could happen, and it made me sick. Coming from a woman's perspective, I honestly can't even imagine how they feel. There is a lack of education, and it definitely isn't something you hear about. This goes against ethical practice. This is literally destroying people. The mental impact this has on someone and their families can be devastating. In Saskatchewan, in 2018, there was a class action lawsuit. It contained reports from over 100 women. Some of the women did not realize that physicians, nurses, and other healthcare professionals and the government couldn't make decisions for them and their bodies. More than 77% of Indigenous people who underwent sterilization were declared mentally defective and could be sterilized without consent, her research says, from one of the reports that I found. Unfortunately, I was unable to find the outcome of the lawsuit. There wasn't many articles covering it.
Brenda Peltier gave birth to a baby girl at the Royal University Hospital in Saskatoon. Her happiness was quickly interrupted.
A social worker came in and that's when she told me, we want you to have a tubal ligation. And I didn't want it. And I told her no. And then that's when she's like, well, we don't want you leaving this hospital until it's done.
A tubal ligation, also known as getting your tubes tied.
I had these nurses constantly coming in. Did you sign that paper? Did you sign that paper?
At the time, the Métis woman was a recovering drug addict whose first 6 children were being cared for by their grandmother. She wanted to start a new life and a new family, but weak and tired, she eventually signed the consent form.
I'm laying there, scared enough, not wanting this done, even telling her I didn't want it done. Then all of a sudden, I smell something burning. If I could have moved my legs, I probably would have kicked her or something.
Peltier and another Aboriginal woman told CBC News they were badgered into getting sterilized. A third woman says hospital staff pressured her after she gave birth to her 9th child, but her doctor intervened to stop it.
First and foremost, when I met with the women, I felt very sorry, and I expressed to them my apology.
The Saskatoon Health Region is hiring an external investigator to examine these cases and whether this happened to more women. It's also introducing a new policy. From now on, only women who have decided with their own physician before arriving at the hospital can get their tubes tied after childbirth. Bonnie Allen, CBC News, Regina.
So some of the questions, have you ever heard of this issue? What is one thing you found interesting about this information, and what did you learn about this topic? And here are my references.